Well, this heat is no joke, and it can be especially dangerous for people who are outside during peak temperatures. It can lead to things like heat exhaustion and heat stroke. So for more on this, we're joined by medical expert Dr. Larry Burchett. Dr. Larry, always appreciate you coming on the show and joining us here. I will say my AC went out today in the middle of a heat wave. So are people without ACs at any more risk for heat exhaustion or heat stroke?
Yeah, absolutely. I was going to say you looked cool. I was jealous of your air conditioning. I don't have it. Heat stroke's a real thing. People can die from this. In 2003, tens of thousands of people died in Europe from heat stroke. Heat stroke is actually when your temperature gets up to 104 or higher, and then people get into trouble. There's two things that I want to talk about, pretty basic, in terms of what you can do to prevent it. Number one is cool down, right? Air conditioning's great. If you need to go outside to get out of your house, get out of the sun, make sure you're wearing a mask. Of course, there's still the pandemic going on, but do things to stay cool. Taking a dip in a pool. Sometimes people ice beverages. The second thing, so get out of the heat and get cool in any way you can. The second thing, I got a question for you, Christina. What is the body's number one way of cooling off? You know this.
Sweating, I guess. I don't know.
Yeah.
You're putting me on the spot here, right. Dr. Larry.
No, I know I did. Well, I didn't know if you were I didn't know if you were still with me. It's sweating, which makes the second most important thing right here. Go Raiders, right? Where's my staying hydrated? So what happens is when people are in the heat for too long and they sweat and they get dehydrated and they start running out of water, they start running out of the body's number one way to cool down. So in the emergency room, when people come in and they feel bad from heat stroke-like symptoms like dizziness, weakness, passing out would be severe, then one of the number one things we do, besides cooling them off in the ER, is we hydrate them. We give them fluid back, because that is your best way to cool yourself down. That's your body's natural way to cool yourself down.
Sure. Okay, so what are the common signs of heat stroke? I mean, if you're at home or you're outside, what am I going to be looking for, and where I say, okay, I need to get some help?
First of all, I think about who, and we're thinking about older folks who have medical conditions. They're at the highest risk. But they feel bad, sometimes weak, fatigued, just generally not feeling well. If it progresses, people get dizzy, lightheaded, they might pass out. Confusion would be a severe form of that. And then, of course, stuff like seizures, people are obviously going to come in for that. If they start feeling bad at all, a couple things you can do. You can check a temperature. You want to make sure it's certainly not 103, 104 just from the heat alone. But again, stay hydrated. So signs of dehydration, including feeling thirsty. Some people can get a headache and just kind of, in general, not feel well. So they're non-specific symptoms. Get out of the heat. Stay hydrated.
Will do. I will say I have my water here. Not a Raiders cup, but I have right by me. Dr. Larry Burchett, we appreciate you coming on and giving us those warnings there. And stay cool, my friend.
Good answer today, Christina. Thanks. Stay cool.